Welcome everybody to our talk, which is pertinent to everybody because most everybody is at risk of getting a cancer diagnosis, or a loved one could get a diagnosis. I just want to recognize, I really appreciate the Eskasoni Health Center there arranging for this talk and empowering people there. And to start out with a land acknowledgement, right? So I'm privileged to live here and work in Makmaki, an ancestral and current home of the unceded territory of the Mi'kmaq. We are all treaty people, and also recognize the histories, contributions, and legacy of African Nova Scotians who've been here for 400 years. So bless you all in your journey. Okay, so when I think about a person who gets a cancer diagnosis, I want really kind of three things for them. First of all, I want them to be cured of their cancer. So we're talking about medical system helping with a cure, or if it's not possible, that they have longevity and really good quality of life, and that they feel better emotionally. It's a very stressful period, a lot of fear, a lot of anxiety, worried about their loved ones. And so how do you settle down those emotions so you can be the better version of yourself? And then ultimately, I also want you to be able to function better with all that stress and side effects of treatment. People's ability to think more clearly can be compromised. I want them to be able to function better so they can do the things they love to do and to be able to connect more within the community. So really, it's not just about cure or not, it's about quality of life, and then meaning and purpose, and how do you maximize that? So the idea is, though, if you don't have a cancer diagnosis yet, I don't want you to get the diagnosis at all. I want to minimize your risk through a healthy lifestyle and quitting smoking and things like that. I want you to not get a cancer diagnosis, number one. If you're going to get a cancer diagnosis, then I would want you to pick it up early, because the earlier you pick up the cancer, the greater the chances that you get cured, and also the less treatment you would need to get cured of your cancer. And then the other thing is, you may not get a cancer diagnosis, but your loved one, your partner, your parents, someone within your community gets that diagnosis, and therefore it's better to understand cancer in the medical system so you can be more supportive of them. So I'm hoping a general talk will really help you understand the medical system, understand what you can do to help yourself and help others, and hopefully not get a cancer diagnosis. So this is how I'm thinking about it, is like, we just talk about cancer generally, and then describe cancer, how to pick it up early, how to get the best care from the medical system, because that's a whole other understanding what cancer treatment is like. So you get an overview. It's not such a big black box. A little bit a talk around how to work with the emotions, the normal emotions that come up, and then prevention, obviously. So Nadia and team, you don't have to answer this, but what's your risk of developing a significant cancer in your lifetime? So this pertains to all Nova Scotians. 40%, is actually more like 50% chance that you're going to get a significant cancer in your lifetime. What's the chance of developing a breast cancer in your lifetime? Probably about 1 in 9 for women. Prostate cancer, maybe 1 in 6. Colorectal cancer, maybe closer to 1 in 10, 1 in 11, 1 in 14. So there's a lot of cancer, and these are all common cancers. And in fact, those 3 cancers can be potentially picked up early if you do the right screening tests and so on, and have a better lifestyle, can also decrease the risk. So overall chance of dying of cancer, 30%. So I'm hoping that through this talk, you minimize that chance for yourself. So distribution of cancers, you can see breast cancer is a quarter of all cancers. Prostate cancer is probably very up there as well. Lung cancer, colon cancer, all sorts of different cancers. Any cell in the body can become cancerous, but those are the big ones. And the rate at which people are getting cancer is going higher and higher, not only because people are living longer, but because our lifestyles are not as good in terms of exercise and diet and so on. So there's increasing incidence of all this. Okay, to start out with, so that's just the truth. We're at risk. So now let's try to understand what cancer is and its treatment so that you have a better understanding and you can feel more comfortable walking into the cancer center and understanding why they're recommending what treatments they're recommending, how to get the best care from them. So you can feel more in control. You can understand how the treatment works so you don't feel so disempowered. Get the best care, make better decisions. It's really, you can have an influence there if you go in and you're supported by the community and you know what's going on. So let's talk about cancer first. So we're thinking about how those cells grow and the immune system, staging tests, and then the major treatment types: surgery, radiation, chemotherapy. Cancer occurs when some cells in your body grow in an uncontrolled way, right? So cells grow, but if they're growing in a way that's uncontrolled, then that becomes more cancerous. Many, many different types of cancer. The cancer is usually named after the part of the body from which it came. So for instance, if you start out with a breast cancer and the breast cancer cells get into the bloodstream and land in the bone, that's still a breast cancer. You don't call it bone cancer at that point. You call it breast cancer spread to bone, for instance. I guess the other really major idea is that um, each person's cancer is different. So you can't really compare yourself with other people. You can do better than expected. Bigger picture, your body is made up of at least 1 trillion cells. Each cell has its own job to do, right? As part of a team. For instance, the skin cells protect the surface so that bacteria doesn't get into our skin, for instance. The red cells, which is a blood cell, delivers oxygen in the body. The platelets help clot the blood, right? So if you get a cut, the platelets kind of stick together and stop the bleeding from happening. The white cells, which is also a type of blood cell, fights off infection, helps you get through treatments, for instance, and many, many, many other cells. Most of these cells are not dividing, and they communicate, they work in a team together. And I tell you about the red cells, platelets, and white cells because with chemotherapy, those cells can all go down, and that's why people can get particular side effects with chemotherapy, for instance. If you look at it underneath the microscope, each cell has a control center, right, which is kind of like the instruction manual telling the cells what to do, and the instruction manual is made out of words and sentences, right? So that's the kind of the go-to book in terms of what the cell needs to do. And then you have this idea that cells are dying off and they're being replaced. So you're kind of turning over, creating new cells over time. Cell division, 1 cell becomes 2, becomes 4, right? 1 parent cell, and those new cells are exactly the same as the parent. Same control center, same book of instructions. And the normal circumstance, if you're not a teen and growing, is that the cells that are made in your body match the number of cells that die. So there's always a net balance between the two. Sometimes the cells need to grow faster. If you get an injury in the tissue, those cells are trying to build up again, but it's kind of under control. It stops growing after it goes through the fast phase. So you get a cut in your skin, the side view of cut in the skin, and the cells at the bottom of that wound start to turn over, start to replicate themselves really, really fast. And it fills and fills in. And they finally recognize that the skin is sealed over and they stop growing so fast. So it's kind of controlled growth from fast growth to back to normal growth again. So how are cancer cells made? They're normal cells with many mistakes. And the mistakes in the cell can happen in a few ways. You can be born with a genetic abnormality. So the cell, all the cells in your body would have some damage or an abnormality in it. But that's only a very, very small percentage of cancers that are kind of, you're kind of born with that disposition. Mostly it's an accident because the cells are dividing. They can make a mistake in the daughter cells. It's called a mutation. And also you get damage in your cells by ingesting carcinogens. So for instance, sunlight can increase the risk of melanoma. There's viruses, there's a fatty diet, carrying too much weight. It all creates this kind of inflammation, irritation of the tissue that can cause cancer. So here's an example. In the prostate cancer world, the normal cell would have an instruction saying, stop dividing after coming in contact with the lining of the prostate. And if that's changed to keep on dividing even after you touch the contact, then there's no kind of break on that system. So the cells won't stop growing. Or hormones are like, or sort of receptors, like this little antenna on the outside edge of the cell. And the hormones are chemicals in the bloodstream that can attach onto the receptor and cause the cell to grow. And if that's changed over to hormone X, Y, or Z is on the receptor, then you're getting this kind of gas pedal. You're telling the cells, keep on growing, keep on growing, keep on growing, which also happens with a sugary diet, just to let you know as well. So why don't we see more cancers? Because you have a repair system that's kind of constantly cleaning up those mistakes. But or the mistake is just not in a very important spot. But if you have a mistake in your cell and it goes into cell division, it comes out as the daughter cell. That daughter cell will have that mistake forever. And the cells that keep on dividing are at risk of developing cancer. So, for instance, the lung lining and so on, or the breast tissue can keep on growing. So, what is cancer? It's a normal cell that's began to grow very fast in an uncontrolled way. However, it takes dozens of changes in the cell before it can become cancerous. And by definition, cancer cells grow or permeate into the normal tissue. So they're invading, they're breaking down into the normal tissue. Or they can kind of float into the lymph nodes or the lymph system or into the bloodstream, float around, land on a spot, start growing 1, 2, 4, 8 cells, like in that one spot, keeps on growing, growing, growing. So I'm showing you this diagram to say this happens over even decades. Normal cell growing along, and then it gets a little bit of damage, and growing along, 10 years later, a little bit of damage, growing along, a little bit more damage, and you get ultimately a tumor, which is a collection of cancer cells. And that's why cancer is so common in the elderly, because they have had decades to slowly grow those changes in their cells. A few other definitions. A precancerous tumor or lump has many of the changes, but not all of the changes of cancer cells. So if it had kept on going, it would have turned into a cancer. Benign often means it's a lump, but it's just kind of growing in place. It's not kind of permeating through the tissue. But if you have a benign brain tumor that's in a really bad spot, it's going to be really hard to remove. So it's not permeating out, but it's kind of growing in the spot and maybe pressing on the tissue beside it. The takeaway is that each cancer is different set of mistakes in the chromosomes, therefore has a different personality. Therefore, you cannot compare your own cancer against anybody else's. And also, you can always do better than expected, right? So the doctors may quote, on average, a person in this situation lives for 2 years, but that's just an average. And so therefore, you could do way better than that, for instance. Or, you have a 90% chance of cure. Well, there's no guarantee with a 90% of cure. So then how does a tumor grow? So a tumor is just a collection of cells, a little tiny potato cells that are kind of growing. So it starts out as one cell, 1 becomes 2, becomes 4, becomes 8. Now, some of those cells are dying off, so it's not quite as dramatic as that. But typically, a lump will double in size over a few months. But even at a cubic centimeter, so the tip of my thumb right here is 1 billion cells. So just to give you an idea as to how tiny these cells are. So then how do cancers cause problems? So if you think about a lump, right? So whether it's where it started or in the lymph nodes or elsewhere, that lump can cause pain or can break down the normal blood vessels and kind of bleed, like bleed into the kidney, bleed into the bladder, bleed into the skin, or it can block a tube like a lung tube or a kidney tube. Or if it takes over enough of an organ like a kidney, it can kind of shut down the kidney or the liver or the lungs, right? So if you get too much of the abnormal cells, the normal cells are going to be able to work. And the body's also working harder and can be fatigued. So you get tiredness often with cancer. And then there's also the blood problems I was talking about, the red cells delivering oxygen and energy, white cells fighting off infections, platelets that help fight off infections. Takeaway, though, is that the treatment is meant to go in and kill off the cancer cells, and therefore it reverses those problems. So that's the idea. So I'd also say that cancer cells can be thought of as fragile, or at least most of them as fragile. You just need to make some changes and you can incapacitate the cell. It's only a tiny percentage of cells that actually can reproduce and cause a problem. Tumors often outstrip their own growth. And so all you need to do is, if you have a lump of cancer, have more death of the cells than growth of the cells, and that we can help our immune system fight off cancer cells. Not that it's a guarantee, but you can, have an influence on that side. So there's the white cell recognizing a cancer cells, engulfs it, eats it up. So screening for cancer. So screening is the idea that you're not having any problems, but you're going to do these tests to see if you can find the cancer early. So it's before symptoms happen. You can feel fine, have a healthy lifestyle, and it still can pick up a cancer early and save your life if you actually do this. So again, I'm showing you all rates of cancer per 100,000, right? And see how there's a spike from about age 50 to about 75, right? So that's when a lot of people will get their cancer diagnosis. Yes, it can happen in the young, but that's how it is. So for breast cancer, for instance, there's lots of different ways that we can have this, including drinking, including carrying too much weight, family history. So there's lots of different things. So in terms of risk factors, inactivity, smoking, there's lots of different things. So what we want then is for people to get a screening mammogram, which is essentially an X-ray of the breast. And if you get it every 2 years and they compare against the previous mammograms, if those are especially at risk, can start at age 40. And by doing mammograms overall, we've been shown to decrease the death rate from breast cancer by about 50%. The other thing I would suggest for every woman is to continue to do self-breast examination, looking for lumps, and then also, have your family doctor examine you once per year as well. Because I'm as a cancer doctor treating breast cancer, I don't know, maybe a quarter or a tenth of my patients say I found the lump, and even before the mammogram became abnormal. And sometimes the mammogram doesn't show you the abnormality. Okay, so here's an example. So this basically an X-ray of a breast, and you can see within that X-ray that there's kind of white spot inside of the circle. So that would be an abnormal mammogram that would be worrisome, and they would say that needs to get a biopsy, which is a sampling of that. So new cases I had shown you. So this is actually prostate cancer. You can see how, again, all those years, all those changes in the prostate does continue to grow and change. And so therefore you can get a prostate cancer 50s, 60s, 70s type thing. Prostate cancer is the #1 cancer in terms of how common it is, but it also accounts for 10% of the death rates. Okay, so what I'm going to suggest is men talk to their family doctor about getting a PSA blood test. PSA is produced by both normal cells and prostate cancer cells. The normal cells, if they get inflamed or infected, the PSA can go up. So not every time the PSA goes up doesn't mean it's prostate cancer, but it is a signal, and it's why the PSA can bounce around. So screening is done when the person does not have problems. If you have problems peeing, you should be in to see your family doctor anyways, right? So if you're having issues, you go see them. Screening is around, you're actually okay, but you actually want to do a test to pick this up early, right? And so I would say it's important to get that first PSA early, certainly by age 50. And then you're talking with your family doctor about getting that every year, every couple of years, according to the PSA value. Now, so there's some controversy as to whether screening helps, PSA screening helps. In my mind, it really does. But once you have a cancer diagnosis, if you have a prostate cancer diagnosis, PSA is excellent. So it's one of those tests that can really tell what's going to happen years in advance, except rarely it doesn't work out that way. Colorectal cancer. So if you get a cancer on the lining of your colon, that can grow without you really knowing, except maybe blood in your stool, something you should be looking for. Again, looking at how the rate of colon cancer goes up and up and up and up, right? So all those years to have the normal cells change into colorectal cancer cells. And on the left-hand side is a picture of this guy's gut. The liver is this kind of triangular thing here. And then The bowel, which has the white stool in it, is kind of being compressed by a little bit of a tumor there. In fact, I think there's a lymph node in that one spot as well. Yeah, in the yellow area. And then this is a scope. So they put a scope up the bum hole essentially, and it looks all the way in through the bowel, and then they can see a kind of abnormality. So this is the normal side. On the bottom is the normal, what the normal bowel looks like, and then this is the cancer on this side over here. Cervical cancer screening, Pap test, I think it's really important. It takes a little kind of scraping of the cervix, looking for cancer. That's a very curable cancer. So again, highly recommend those type of screenings. All right, so medical system. So I talked about do your screening tests, follow your family doctor's advice, because you can pick stuff up early and that could really make the difference in terms of less treatment, higher chance of cure. But I want to take you into the kind of steps of what happens within the medical system itself. So person usually has symptoms, they have a problem or some type of screening test, some x-ray or something or other shows something, could be incidentally on a scan. So they get that first look saying something's the matter, there's a lump there, there's a problem there. And the first thing they need to do is try to figure out what it is. And that's taking a sample, sticking a needle in it, taking a sample, looking at it underneath a microscope is called a biopsy. And so essentially you look underneath a microscope and at it, and it proves it's cancer, typically tells the type of cancer, and then kind of gets the whole system running to make sure that they can take care of you each step of the way. These are cancer cells looked at underneath the microscope. You can tell that things are very kind of chaotic there, right? So there's all sorts of different shaped cells. There's not many normal cells there. Next step is staging the cancer, means has the cancer spread or how advanced is the cancer? How bad is the cancer? And so they look at how extensive is the cancer where it started? Did it spread to the lymph nodes? Did it spread to other parts of the body? That's doing staging tests. It also tells us, once we know the staging, what is the right treatment, and also tells us what they call the prognosis, which is what's the likely outcome, what's going to likely happen, what are the chances for this person. So staging of the cancer, blood tests, right? You can see if an organism involved, x-rays, PET scans, CAT scans, bone scan is a special way of looking at the bones. I think I have one. MRI is just like a very special scan. It gives more details. CAT scans kind of takes you like a loaf of bread and looks at you on the inside. PET scan. The grade is how fast growing the cancer looks underneath a microscope. So if someone says they have a high grade cancer, it means it's a faster growing cancer, which is different than stage. Could look at the receptors, like the hormone receptors on the cancer cells. They could look at the genetics within the cancer, which is the words and sentences in the cancer cell. And I want to just give you this other idea. So what I've taken here is it's a picture of a bone. Like think of my arm bone and kind of cut it off and look at the end of the arm bone. So the bone is made up of all sorts of cells, and I've drawn just one cancer cell in here, all to say that any type of bone scan or CAT scan or any scan is just not going to be able to see this one tiny cell. It means that you could have a, quote, normal scan, but actually cancer cells in the bone. So when they say it's a normal, it means there's no obvious cancer in that area. So then the doctor's trying to figure out, looking at that person in front of them, what's the stage of the cancer, what type of cancer it is, and they're asking the big questions. Can this patient be cured of their cancer? What's the best treatment? How fit is the patient? Can they get through the treatment? What does the patient want? And we're trying to figure out all the options. Do nothing, go for cure, treat without going for cure. Like lots of different ways that we can go. And we have that discussion with the patient so they know what those options are. Can you be cured? For me, the word cured means the cancer never comes back. There are no cancer cells left in your body. They don't regrow. Therefore, you've been cured of your cancer. You live to age 95, you die in your sleep. Adjuvant means an extra treatment. So maybe you have like a breast cancer. You do a surgery, remove the lump from the breast, and then they can add an extra treatment because there's always a chance that there might be some cancer cells left over. And so they add extra treatment like radiation to the breast or chemotherapy or hormone therapy. So it kind of treats a probability, because once you've had the first surgery, there's still a chance the cancer could come back. If you add extra treatment, it reduces the risk of the cancer coming back. There's no guarantee. Almost all the time, we don't kind of give 100% guarantee. In remission, however, to me means there are still some cancer cells left over in the body, but there are only a few cells that they can't really see, and we're expecting the cancer to come back at some point in time. So in that situation, it's incurable, and the aim then is for many years and of great quality of life. Overall, the doctors don't recommend the treatment unless the benefits outweigh the risk. And you always have to have two sides to this, right? This will improve your chance of cure this much, or this will improve your longevity this much, but there's the chance that you could have this. And that's a risk, right? So no guarantees of cure and no guarantees of side effects. They're all probabilities, all chances. So surgery, think about it, you're cutting the tissue. So almost always some of the normal tissue comes out with that as well. But so the tumor or the lump of cancer is removed, and there can be an effect in the normal tissue. And there can be a chance almost always that there's some cells left over, that it's spread or it's beyond what they can see, right? Because the cells are so tiny, it's always a chance there's left over. Chemotherapy, so that's given by a medical oncologist. I call them a chemotherapy doctor. It goes everywhere, right? You get an injection or pills, it's going to go everywhere in your body. And the idea is that it would hit onto the cancer cells, hopefully a lot more than the normal cells, and kill off those cells. It's typically given in courses, meaning like, 1 week of chemotherapy and 3 weeks off, one week of chemotherapy, and so on. The issue is that it can affect the fast-growing normal cells, like the cells of your mouth or the hair cells or the skin cells or that type of thing. And there's better and better chemotherapies that are really even immune modulators that are like a lot less side effect. And again, each person is different. The doctor is watching to see, and they can adjust the chemotherapy, adjust the medications that help with that. And that there are specific types of side effects for each type of chemotherapy. And there are treatments like nausea pills and all that type of stuff that can get you through that treatment much more easily. So then chemotherapy, if you're hitting both cancer cells and normal cells throughout the body, that can cause fatigue, right? So whole body side effects. You could have nausea, could hair loss, could be low blood cells, could be a sore mouth and throat. It's very varied, and it really depends on the type of tumor that you have. There's some really very good now. So two types of therapy. So targeted goes after the cancer cell, really minimizes the dose to the surrounding normal tissue. Okay, so then radiation is something that's very specific, right? It's aimed at a particular part of the body. It's given by radiation oncologists, like getting a chest x-ray. There's both external and internal radiation. And the side effects are really in that area, other than a little bit of fatigue, for instance. And then there's lots of very high technology radiation, where they're aiming radiation from lots of different directions, and really it hits the tumor, but there's always going to be some normal tissue that's going to get the radiation treatment. So hopefully that's within tolerance. So this is a linear accelerator. If you're going to have radiation, you lie in a bed, and this big machine would aim some radiation into that part of the body. You don't feel it or see it. You're not sick to your stomach. You don't lose your hair from this treatment of breast, so on. The radiation is this wave that hits the chromosomes, the word and senses that kill off the cancer cells. And then chemotherapy slowly permeates into the cell, can hit the edge of the cell, can hit the middle of the cell, can hit the chromosome. So chemotherapy can have an influence on cells in lots of different ways. Ultimately, you're causing damage to the cells. They can't divide. When they try to divide, they die. It's really the kind of the takeaway. That hormone treatment is like blocking a pathway, because hormones oftentimes feed the cancer. And if you have a hormone blocker, then it stops those cancer cells from turning over. And oftentimes the cancer cells will die with that. And for breast cancer, for instance, it can be in pill form. For prostate cancer, it can be in the injection form. It can actually increase cures. So that's the really cool part. However, like any other treatment, any other pill that you would take, there are chances of side effects like hot flushes, for instance. Okay, I want to take you through the radiation world. So you probably 1 in 5 of us, 1 in 4 of us are going to actually be under a radiation machine in our lifetime. So we start out with consultation, meaning trying to decide to treat or not to treat, cure or not, or incurable. So there's mobilization devices, and that can hold the person tight to the table because we don't want them to be moving during radiation, because radiation is moving at one spot and they don't want to move the normal tissue in the field or move the tumor out of the field, for instance. So simulation is what they call markings. You go in for a CAT scan, you left some little tattoos in the skin that are permanent, essentially, and it lines you up for the radiation treatment. So they do a CT simulation, which is essentially a CAT scan or markings. They put on these little freckle-sized tattoos, and that gets you ready for the radiation. Next is, once we have that CAT scan, we start to outline the tumor and the normal tissues on the CAT scan set. And we have somebody plan the radiation beams coming in different directions, for instance, skimming across the chest wall and catching the breast and minimizing the amount of lung, for instance, the breast cancer field. So this is a plan or distribution of radiation. You can see the brown area is where the surgery was done, and the radiation kind of skims across this area, and you're left with a distribution. So the side effects can be in any one of those areas. So that's breast radiation. And then you go on to a machine. Essentially, this is where the radiation is delivered, a linear accelerator. You're lying down on the machine. The therapist set you up. You're in the room by yourself for about 5-10 minutes, and you can do that just once. You can do it 5 times, like once a day for a week. You do it over 6 weeks, just depending on the treatments. And then there's a radiation console. You're in there by yourself. They can see you, they can talk to you, et cetera, but you're there by yourself. And the radiation therapists apply that beam. So there again is just a radiation therapy idea. And then just to say that there are lots of really incredible technologies where they're aiming beams in lots of different directions that can really zone in and hit the spot. This is a person who has cancer spread to their brain. There's a spot in the brain here, and it's getting that super high dose radiation to sterilize that area. Okay, so big picture. Now that you know about the treatments, what is it that you can do to help yourself? So start with information. That's the first beat, is the understanding what's happening. And there's just lots of different ways there. Then you advocate, you get the best care from the medical system. You empower yourself, exercise, diet, sleep. These things we're going to talk about in terms of healthy lifestyle habits, settling the mind, decreasing your stress, remembering what's most important. That might be your spirituality, right? So use what works for you. There's not every advice here is going to apply to your situation, and it's going to change with time. You want to both use your rational mind as well as that kind of inner wisdom. When you're first diagnosed, you have to get information, make a good decision, and then you're on treatment, and then you can be in follow-up. So there's different things that happen during those different periods, right? And so information, you're learning to speak the language of the medical system. You can empower yourself in ways beyond the medical system itself. So really, to be able to understand what's happening helps you make good decisions, helps you advocate for yourself. You can't be getting too much information if you're getting tired by thinking about this, or you're going onto the internet and it's giving you one set of advice and your doctor's giving you a second set of advice. You really need to trust your doctors to say that it's individualized to your situation, and they're doing their best. That's the place I want you to be, is to be more trusting. So information, your oncologist understands the situation best. And in Canada, you are likely going to get a good oncologist. They're very well trained. But you prepare for those conversations by reading about it in advance. You can go to the internet. Sometimes there are libraries, or librarians. There's not-for-profits for your particular type of cancer, like breast cancer groups, for instance. And then You prepare for your visits. You prepare beforehand. You contact your physician if you have questions or concerns. You can tap into other services if need be. You can ask for a second opinion if you really feel uncomfortable in the circumstance. I'm going to take you through it. So before the visit, make sure you understand your story. Bring a list of your medications and allergies. Write down your questions beforehand because it's very stressful going into that visit and you often forget what you wanted to ask. Like you might want to ask, what's my chance of cure? And they just never bring it up unless you look at your questions. I think it's best for you to bring somebody along with you and they can be kind of like the scribe or you can record the session. And I like the fact that most people could bring a file of the results and get a copy so they know what's actually happening there. When you're with your physician, you want to be open about what's most important to you. Sometimes the doctors are using very complicated language and you want to be able to say, slow down, doc, I don't understand what you're talking about. Can you please explain in easier language? Oftentimes the physicians will give a summary at the end of their talk with the patient, and then you can ask all your questions because the summary often includes a lot of that information. So I think it's important to try to record somehow, and that's why I bring a friend or a loved one to help make sure you're remembering all the information. Find out what to expect. Find out which side effects to look for. How bad do they need to be? Who do you call at 3 a.m. if you run into a real problem? You should kind of have a backup plan and know what you need to do. Keep a journal. If you need be, if you have to explain this to family members, friends, you can ask for a family conference. The idea, though, is the medical system is there to serve you. You're the most important person in the room. And sometimes your family member or friend can be the one who's doing the talking, that kind of advocating and so on. If you're feeling like you don't know what's happening after the appointment, ask for more information. Call back, leave a message, say, please call me, or get onto like a call with the speakerphone. In terms of second opinion, it's really as if you're thinking, no, I'm not getting good treatment at all. And so how do you ask for a second opinion? You ask your family doctor to send you to another specialist or ask the nurse of the specialist to send you get a second opinion. Again, the physicians should be able to do that for you because it's your peace of mind, your care that matters most. There are lots of other things within the medical system, right, that can help you. There are lots of other resources here, social worker, there's different community members, there's the health center, right? So you keep on asking, what am I missing anything? Is there anything else I need to do? You keep on asking, talk to an expert. Okay, so I just want to kind of normalize that getting a cancer diagnosis can cause lots of emotional issues. There's the kind of shock, there's the fear of recurrence, feeling guilty, feeling like a lot of people feel lonely, disconnected at the end of all that, or frustrated. No, it's all normal stuff and they can be exaggerated, they can come and go. And so dealing with difficult emotion, there's no one right way. Find a wise person to talk about, get extra care, and to realize that things will change with time. So when do you need to get extra care? As if you're feeling overly depressed, you're crying constantly, you're withdrawing from community, you can't enjoy yourself at all, you can't joke with your friends and your family, can't make a decision with your treatment, you can't sleep, you can't talk about cancer because it brings up awful memories. So there's lots of stuff that says, oh, this is a lot. I need to talk with somebody, psychologist, an elder, a good friend. You know, you need the kind of support when you're into those circumstances. So how to get help? You talk. You visit your family doctor. You visit an elder. You visit a friend. You ask for expert advice. You go to a support group like you have at the health center there. There's a lot of different ways there. Support groups are very helpful. People get it, right? They understand. They're with you during all that time. I just want to touch briefly on complementary medicine and this idea that there are treatments outside of the medical system, but I wouldn't want you to forego a proven treatment. Tell your doctor what you're taking, for instance. So conventional treatment, we talk about proof, like what's the science behind that actually shows a benefit. And as I've been trying to be balanced in terms of showing about risk and benefits. And because of that, so they're there. The issues around complementary medicine, like, I know, call it snake oil, or like could be SIAC. There's a lot of different stuff there. It can be expensive. The practitioners can make claims that are unproven or false. Oftentimes there's some toxicities that we don't know about. And I would also caution you against extreme diets there. And so what do you ask that complementary medicine practitioner? Somebody's selling you snake oil. You want to ask, where have you been trained? What's the quality of the evidence of this treatment? And what's the proof? Not just like it's been helpful some of your patient. What is kind of the scientific proof? How much treatment, how much cost? So you really need to kind of make sure that you're asking a question. Okay, so lastly, I want to talk about this idea that you can get your body stronger for the treatments, and you don't want to let slow growing cells, if they're there, turn into fast growing cells. So talking about 30 minutes a day, 6 days a week, doing something to get your body moving, something that's fun, that you enjoy, is actually helpful there. It improves mental health, it improves energy, the quality of sleep, and I just think it's good. Other thing is to stand up 5 minutes on the hour. I'm not going to take you through the quiz. Nutrition, right? So there's a whole anti-cancer diet. Essentially, you want to eat more whole food, plant-based diet. And yes, it is more expensive, but there are some cheap options to find that healthy diet. In fact, I was eating some of the beans at lunch today that was healthy and cheap and so on. So you improve your immune function. I would always suggest that if you're running into problems, that you talk to an expert. General advice: you're getting food from multiple food sources, lots of fruits and vegetables, healthy fats, plenty of healthy fluids. You're swapping in the water for the pop, for instance. You're maintaining a healthy weight, and so on. Typically, I wouldn't say, in fact, I'm going to take that off right now. I wouldn't say calcium, just it's vitamin D. Now, calcium by itself is not a good thing, because it just increases your clot risk. You get your calcium through healthy foods. Maintaining a reasonable weight, sleep, trying to get a better night's sleep is also very healthy for you. So all of these things can contribute to feeling better and stronger. Practicing a relaxation technique. I pulled this one off the web, of this woman who's Indigenous, who also kind of teaches mindfulness and a relaxation technique. So there are ways to actually improve your health by relaxing your nervous system and getting less stress within the system and tapping into spirit more. So there's lots of science around being able to do that. I think that's it. Yeah. So what can you do to reduce your risk? Smoke less, exercise, eat a plant-based, healthy fat diet. I should probably change that to healthy fat. It's funny, I gave this talk first in 2016, and things have changed a little bit. Maintain a reasonable weight, limit your alcohol consumption. Those are all important things. Avoid the sunburns, right? I think that's it. So blessings on the journey. How much can you reduce your risk of developing cancer by exercising, eating a healthy diet, and maintaining a reasonable weight? Let's just change that word right there. Reasonable weight. The answer is 33%, right? So you decrease your chance by a third of getting a bad cancer if you take care of yourself. Advice for family members: be open and honest. Your feelings, what you're going through. Take your cues from the person that's diagnosed, because they're the kind of the team member, they're the leader, and you can still enjoy yourself. You can still find the moments of beauty within the difficulties.